the aim of this project is basically to put together information to show not just to patients but also to clinicians and to people that work in emergency medicine what hereditary angioedema actually is as a condition, how it needs to be treated, and the best way to go about it in a timely fashion.
HAE, or hereditary angioedema, is a rare inherited condition that causes swelling. There are probably about 1,000 to 1,500 people in the UK with this condition, so it is a very rare disease. The swelling can affect different parts of the body. It can affect the limbs, so hands and feet. It can affect the abdomen or the stomach. The pain can be so bad it can actually be mistaken as something requiring surgery, and often a lot of these people have had sort of surgery inappropriately. The other part it can affect, which is the most dangerous, is it can affect the airways or the larynx, and obviously that affects the breathing, and people have died when they've been unable to breathe.
And we found that patients are traumatized. Every time they have to go to A&E, they find it a traumatic experience each time. That's because they're already scared of going to A&E, but they've had to make that journey because there must have been compelling medical reasons for it. And then every time they go there, they're not trusted or believed. I can imagine that it must be super traumatic.
We have 10, wonderful doctors that as soon as we arrive, they're like, "Hi, Charlie," straight away cannulate him. They educate the other doctors, "Oh no, Charlie's in and out," but you'll get that one doctor that will push where Charlie says it hurts here, and they'll feel the need to actually push or do the pain score. The pain score doesn't work. We've actually had a doctor say, "What is your pain score?" And Charlie's gone, "It was a 7, but it's gone down to a 4, and they've gone, "Well, we're not doing the medication then." It actually made us not go into hospital the following time.
Going to hospital, it's not a nice place. Being told that you're wrong when you know you're right, and everyone else knows you're right, just bad.
It's very unlikely that someone would fake this condition because of the rarity of the condition and because of the severity of it. In an ideal world, we would like if any clinicians would have, or at least come from a position of faith and maybe trusting that the patient does indeed have this condition and does actually require urgent treatment because of the severe consequences of not treating it quickly enough, rather than being naturally sort of suspicious of things that they may not have heard of before.
Don't be afraid to put your hands up and say, "I don't know anything about this condition. Can you teach me?" Or, "Who do I need to call to get more information on how to treat you?" Because at the end of the day, you're going to have someone who's going to stay in hospital for less time if you actually either follow the letter or talk to the immunologist who's looking after the patient.
I understand it's rare, and I understand that it's not something they might come across at all or ever have come across before. But at the same time, I believe is on my record, I've got the documentation, I've got the medication with me, so I've got 2 points of reference to go against, and also afterwards not having to wait around for hours and hours to be released as well. I suppose it's just the trust of the patient knows what they're talking about.
We're the experts in our illness, and I hope that they just listen to us when we're in like A&E, and you go in and they say, "I'm having a throat swell attack," and you can't see that, just listen, and they say, "I need this treatment," and listen. And if you don't know, go and ask someone, ring the consultant. Just really follow the steps. It's really simple. Patient comes in, they know what's wrong, most of them. Give them the infusion, give them half an hour, don't keep them in, let them go home, they need to sleep.
Treat them as per the request that the specialist has given, the form that the specialist has filled, saying these are the medications that work best in this scenario. By all means, suspect other conditions, although these are rare, they do happen to patients with HAE, but treat them first for angioedema. And if that hasn't sorted the problem out, then go through your checklist.
There is no blame being put on clinicians here, far, far from it. In fact, it's almost the opposite. Treatment for patients is a two-way street. It's reliant on the patient keeping good records and having those good conversations with their clinicians. It's also about the clinicians being able to understand their patients when they have each consultation. And they perhaps just need that little bit of extra support to be persuaded that, now's the time for change. This could make such a difference to your life.